Welcome to the Sherborn Business Association Spotlight on Sherborn Business and Professional People. The Sherborn Business Association has over 40 members and is organized for the following purposes. 1. To create a well-informed, charitable, and effective organization to serve the many businesses and social needs of the community. To familiarize our townspeople with the many business and professional people that serve our town. To gather and distribute information to the membership regarding municipal laws, procedures, and proposals. To promote networking within the association. And to aid our town government in promoting a better, healthier business climate to benefit all of us in the Dover-Sherborn area. The Sherborn Business Association's website is www.sherbornbusiness.com, no spaces. We encourage you to visit our website and get to know your Sherborn businesses. Our meetings are usually held on the first Monday of each month at the Sherborn Inn at 7:30, preceded by a 30-minute social. Although meeting times and dates are usually promulgated to our members by email. Today the spotlight is on Lily Ling, DMD, a general dentist who has opened her own practice here in Sherborn, which is known as Sherborn Family Dental. First of all, welcome to the program.
Thank you.
And thank you for being our very first interviewee on this program.
It is my pleasure. Thank you very much.
Thank you. You have opened your own solo practice in Sherborn, and I admire your courage for opening a solo practice in this climate, in this day and age. First of all, tell us about your practice, where you're located, your office hours, and so forth.
Of course. Well, David, we're a family general dental practice located right in the heart of Sherborn Town Center. We're located on the first floor of the big yellow building called Sherborn Crossing, and we're adjacent to Walgreens Pharmacy. So we're open every day except Mondays. We're open Tuesdays through Fridays and every other Saturday. Tuesdays and Fridays we're open from 8 a.m. to 5 p.m. Wednesdays and Thursdays we're open a little bit later for people who'd like to come in after work. So we're open from 10 a.m. to 7 p.m. And then we're open every other Saturday for folks who'd like to come in on the weekend from 8 a.m. to 1 p.m.
Do you handle emergencies?
We do. Emergency calls are on a first-come, first-served basis. We are welcome to see emergencies during business hours. People can walk in if they need emergency treatment at that time, and we can try and fit them into our schedule. Or if emergency service is needed after hours, they can call our cell phone, and I will answer and arrange for a time for the patient to come into the office.
That sounds convenient. For sure. You have a very interesting background, coming from a family of physicians. Where were you born, educated, and how did you find your way into the dental field?
Well, David, I'm originally from a Midwest town called Grosse Pointe, Michigan, and my educational studies actually brought me out here to the Northeast. I did my undergraduate college education at Brown University, followed by dental schooling at Tufts Dental School in downtown Boston. I graduated in 2007, and thereafter I did an advanced education in general dentistry residency at University of Connecticut in Farmington, Connecticut.
So you received your doctorate from Tufts, which is one of the most highly recognized and famous dental schools in the world, and you were educated in every phase of dentistry. Did any particular area of dentistry interest you?
Well, David, one of the things about general dentistry that I love so much is that you're not limited to specific areas of dentistry. You can do simply as little or as much as you want, as you feel comfortable with. But if I was forced to choose between areas of dentistry that I have a passion for, it would probably be with preventive dentistry as well as aesthetic restorative dentistry. And the reason why I enjoy preventive dentistry so much is not only do I feel that it's so important for the patient to understand that oral hygiene is so important to their everyday activity, is the patient needs to understand that with good oral hygiene, good preventive dentistry, healthy bone and gum tissue is so important to advancing the lifespan of any restoration that's placed in the mouth. In addition to that, my other passion to aesthetic restorative dentistry, I simply just love to see the transformation that we can do for our patients with just fixed crowns, bridges, and veneers. And you know, when you change a person's smile and you make it nice, you really instill a lot of confidence in them and make them a happier person.
That's for sure. You talked about preventative dentistry. We in Sherborn have only wells, and I'm just wondering whether or not you have some type of fluoridation effort that you make in your practice.
Well, David, I'm so glad that you mentioned that, actually, because our practice, Sherborn Family Dental, is currently in the process of coming together with them, as well as the elementary schools in the area, to come up with a program so that fluoride can be readily available to a lot of the patients in our community as well as the surrounding communities. I know Sherborn, we are on well water, so currently there is no fluoridation process that's out there, and we would like to make it available to our patients and the community.
Do you recommend individual fluoridation for children and for adults as well?
Adults, not so much, but for elementary school kids from ages 3 and probably up to the ages of 14, I think it is very important, especially to focus on the diet, oral hygiene practices at home, as well as having fluoride in their diet, incorporated into their diet.
Do you like topical fluorides, or do you prefer rinses, or how best do you like to dispense individual fluoride treatments?
Currently, we're using topical gel fluoride in the office. I think that's a good start during your every 6-month recare programs. However, on a normal day-to-day basis, because there is no fluoride in the water, we can simply use fluoride drops to be placed into the water when we're drinking it at home, or we can also use fluoride tablets.
You were educated also at the University of Connecticut. I believe you took a postdoctoral internship at the University of Connecticut, and what was that for? What did that entail?
Well, it was a general practice 1-year residency after dental school, and it basically gave us the full experience of being able to work as a general practice dentist in an office. We were lucky to be able to have a lot of specialty clinics in the university as well that we could work with together to come up with a treatment plan for a lot of our patients. So it was a combined effort.
So you learned a lot about other specialties in dentistry.
Oh, indeed.
At the University of Connecticut.
I actually have to say that that's exactly where I learned a lot of my oral surgery experience, especially with extractions there.
Well, they have a good oral surgery unit at UConn, I know that.
They really do.
I have visited your office in Sherborn and find it to be very well designed and friendly. Are you responsible for the design? Is this something that you came up with, or is this in concert with a contractor? Or
it certainly was, David. I wish I could take full credit for the design, but I absolutely cannot. I actually worked with a construction firm right from Sherborn, C Square Construction, run by Eddie Koppelman and his team, and they were able to help me with the design of the office to create the clean, comfortable, modern, state-of-the-art office that I imagined.
Well, you certainly have succeeded in that. I think it's a wonderful office.
Oh, thank you.
I've met Lori, your receptionist, and Emily, your assistant, both of whom are very personable. Did you interview many people for these positions?
I did interview many people, but I just got so lucky to be able to hire both Lori and both Emily because they're so experienced in the dental field. Lori does have a lot of experience in a lot of startups for dental practices, and Emily had a lot of experience in schooling with dental assisting, and She also is a certified dental assistant.
Well, I think both of them are going to aid you considerably in your practice. I'd like to talk a little bit about treatment planning. How do you go about your initial examinations and set up your treatment plan?
Generally, David, what I do for a new patient that comes into the office is I'd like to start with a comprehensive exam. Now, the comprehensive exam includes review of medical history for the patient, as well as an extraoral exam and intraoral exam. The extraoral and intraoral exam includes a soft tissue screening or oral cancer screening, just so we can evaluate the soft tissue and the facial features to know if there's any sort of lesions that look out of the ordinary. And certainly if there are any lesions that look out of the ordinary, we want to be able to treat that for the patient early on rather than later on. And then we would refer the patient to an oral surgeon to have the lesion biopsied, and then the lesion evaluated by an oral pathologist, one of the oral pathologists over at Tufts Dental School.
Crowding is one of the earliest problems in the younger patient. Do you handle any simple orthodontic problems yourself, or are they all referred out?
More complex orthodontia is generally referred out to many of the local orthodontists that I work with in the area. But currently I'm working on getting certified with Invisalign as well as ClearCorrect clear aligner systems for patients who may be interested in simple orthodontia or a patient who might not want the conventional brackets.
That's very good. I know that you're handling some of these orthodontic questions basically at early ages can prevent orthodontic treatment in the future. You do cancer screening, you said, and
yep.
You do not do your own biopsies, or do you do your own biopsies?
I can do my own biopsies, but if it's something that I feel that is more, if it's a lesion that's a little bit more developed that I want to make sure that I do a full biopsy, then we generally refer that out to an oral surgeon.
Anesthesia is different for different offices. The types of anesthesia that is used, the type of anesthetics that are used vary considerably from office to office. What are your techniques?
Well, David, currently at our office we only use local anesthesia, which is via the anesthetic carpules. We do not offer nitrous oxide sedation, and we don't offer general sedation, which is something that you would typically find more in a hospital type setting. However, what we are willing to do is, if a patient may think that they need to be pre-medicated because they're a little bit anxious prior to their dental procedure, upon review of their medical history to make sure that there are no contraindications to their medical history with taking some oral medication, we can prescribe anti-anxiolytics for patients in order to make them more comfortable when they come to the office.
What is this single tooth anesthesia all about?
Oh, thank you for bringing that up, David. Actually, for patients who might be a little bit more nervous about coming into the office for dental treatment because they're nervous about certain types of local anesthesia, we offer something called the STA system. The STA system is short for single tooth anesthesia. So, for example, if a patient is coming in and they're a little bit nervous about having treatment on a mandibular tooth, where a typical dentist may actually numb up the entire lower quadrant of the entire lower quadrant in order to be able to do treatment on that tooth, what the STA system does is it's a painless injection technique where the anesthesia is actually administered at a very, very slow rate of almost 1 drop per second. And what this system does is it numbs up the specific tooth that you're working on. So it actually allows the dentist and the patient to have treatment done on multiple quadrants if you want at once. And also, when the patient goes home, they're a little bit more comfortable because instead of being numbed up on a quarter of their mouth for several hours, they're only numbed up on that specific tooth that we've worked on for a small amount of time, just an hour.
For these very anxious patients, do you recommend pre-medication, sedation of any kind?
Generally, we encourage trying to do dental treatment without pre-medication, especially if there is some sort of contraindication to their medical history. But if the patient thinks that they do feel more comfortable being pre-medicated with oral sedation, we can certainly do that.
You have all the latest in high-speed equipment, I know that. So most of your procedures are done pretty quickly, I would imagine.
They are done pretty quickly, and one of the nice things in our office is we also, as a doctor, I've decided to do my own hygiene in my office. So you're never going to see a hygienist as of yet. And it's kind of nice because we have a new way of cleaning the patient's teeth called ultrasonic or piezo type cleanings with a special instrument that vibrates quickly and has a lot of water spray that comes out. We can clean the patient's teeth that way instead of the old-fashioned, more conventional technique of hand instruments.
Well, it sounds very appealing to me, and you might just have another patient on your hands here. Can you give us a summary of your education, your background, coming to Sherborn,
Absolutely.
Dentistry, and let's call it a day.
Sure. So I currently live in South Natick, and I'm happy to be a part of the Sherborn community, otherwise known as Sherborn Family Dental. We are a family-friendly general dental practice located right in the heart of Sherborn Town Center. And we're a clean, comfortable, modern facility. And we like to see patients we welcome patients of all ages from ages 3 and up. So please come join us. We'd love to meet you and see what we can do for you today.
Thank you, Lily, very much. This was our first interviewee. I'm Dave Sorter, and I'm affiliated with the Sherborn Inn. I did want to just say thank you for watching this program. And remember, the Sherborn Business Association is something that is supposed to make your lives better. So let's use our businesses in Sherborn, and I think it might benefit all of us. Thank you very much for your attention.